Hello, I'm talking to Victoria Zaslona. Victoria is a SAS doctor. She's a specialty doctor in forensic psychiatry in the Midlands. So, Victoria, thank you very much for joining me. First of all, tell me a little bit about yourself.
Hi, Jane. Thanks for having me. Yeah, I am a specialty doctor, as you said, in forensic psychiatry in the Midlands and have been for the past 9 years. I have a very young family, so I've got a 6-year-old and a 3-year-old. And I didn't start off wanting to be a SAS. That's the interesting part of my journey, I think. I think it might of quite a few listeners might relate to that. So I graduated from Leicester Medical School, and after my FY1 and FY2 year, I went into GP training for a year, and then changed my mind that psychiatry was the thing that really interested me. So I went into core psychiatry training. After a couple of years of core psychiatry training, I realised that in terms of work-life balance, in terms of trying to make decisions that were better for my personal well-being, I wanted to leave core training and explore what other options were out there, of which there were many. So I left core training and had a plethora of choices, and made some choices to locum for a very short time, and then managed to get myself a substantive specialty doctor contract with Nottinghamshire Healthcare Foundation Trust.
So
And
can I interrupt you there just to unpick a bit of that because you've gone through an awful lot.
mhm,
So you started by wanting to be a GP.
mhm.
Was there something about GP that maybe didn't quite fit what you wanted to do?
I think so. I think you start off thinking that general practice is going to be the family friendly option and the one that's going to be supportive in terms of giving you the most in terms of a personal life.
Hmm.
And actually, the reality is that I think it's probably one of the places where you struggle most with that. I think
But you
maybe.
you hear about a lot of people struggling with how busy and how difficult primary care is these days. So then you decided to do psychiatry.
Mhm.
Um, you said you had a lot of options. What were those options?
Do you mean when I left core
Yeah,
training? Yeah.
yeah.
Yeah, there were a
Or no, sorry,
lot.
you went from GP into psychiatry,
Mm.
and then stayed in psychiatry, and that was
For
okay.
yeah, I stayed in core training and sat my paper A and got my paper A, um, achieved some of my competencies. There were some things that were more difficult than others in terms of jumping through the hoops of that is training, and it was limiting my personal life and personal well-being.
So how was it limiting? I mean, paper A presumably is like a part one of a series of exams. I'm not
Mhm.
familiar with it. Um, what was it that made it hard for you to carry on, or made you decide not to?
If we're in terms of exams, so paper A, I did sit. I got it after sitting it 3 times, so I managed to pass on my third attempt. I found the preparation for it while I was working really tricky, and actually ended up being referred for an educational psychology assessment, and being diagnosed with dyspraxia. So then having quite a few adjustments to the exam process, and that was the time that I passed. But yeah,
Gosh.
it affected my personal well-being and my confidence,
And
not
did you
passing
have
the
children
exams.
by then? Did you have children, partner and children and what have you?
Partner, but not children.
Right. Because often women have an enormous burden of extra stuff that goes on in their lives. In fact, I think it's not exceptional. I think we all do at some stage. Okay, so back to the story. Then you had a lot of options. What you decided to leave core training.
Core psychiatry training, because
Yeah,
psychiatry is dual, um, split into 2 parts. So you've got your core
right.
training and higher training. Yeah. Um, I looked around at what jobs were available in terms of locum jobs, and found there was a lot out there that suited me in terms of my experience, but also areas that I hadn't worked in yet and wanted to work in. So things like psychiatry, intensive care units, liaison psychiatry. Yeah, a lot of options.
So would you have had the same options if you'd hung on in and gone into higher specialty training? Or was the choice important to you?
I think, yeah, I think you have to make quite a few choices if you're following a training career path, and that may limit the choices that you have in the future. So, for instance, if I'd finished core psychiatry training and then would have had to have decided what higher training I was going into. Would it be forensic psychiatry? Would it be adult psychiatry or CAMS, or what subspecialty? And then I would have been tied to that training scheme, and yeah, wanted to follow it through really for the next 3, 4, 5 years, however many it took me to get my CCT.
Gosh, so it's long, isn't it? It's a lot. So you started doing locums.
Yeah, for a few months I started doing locums. Yeah,
and how was that?
it was really good. It was actually really refreshing because the locum roles are often created out of a need for service provision. But what I found, contrary to kind of my initial beliefs of kind of these types of roles, was that I was given quite a lot of autonomy. My supervisors got to know me and my experience and recognised that I had already had a few years of psychiatry experience, and that they were there to supervise and not to kind of dictate to me, which was really nice. So it allowed me to develop within that role. It was worth it, not just for the service provision, but for my professional development.
Gosh. So then following that, then you decided, right, SAS is the thing for me. Is that right?
I did.
So tell me about SAS doctors. What people, I think people don't really understand what SAS doctors are, if I'm honest. So tell me all about it. That probably means just I don't really understand it. So tell me all about it.
So SAS is a great term. SAS stands for Specialty, Associate Specialist, and Specialist Doctors, which is a mouthful. And we were kind of rebranded not so long ago, a few years ago, but traditional terms kind of include staff grade, trust grade, all those types of things. But the important thing about the SAS grade is it recognises your experience within the field within which you work. So SAS doctors will have a minimum of 4 years clinical experience, 2 of which will be in the specialty they work in. And that's kind of what makes it different from things like locally employed doctor roles, which also tend to not follow a nationally agreed contract, the LED, locally employed doctor roles. And the SAS doctor role does follow a nationally agreed contract that was negotiated by the BMA on our behalf, and has much better terms and conditions.
So when was that? Was that
So
before you became a SAS doctor, or did it happen afterwards?
it was just before, so
Right.
2016, and then there's been an update to the contracts in 2021, the SAS doctor contracts, of which now there are 2. So you can either be a specialty doctor or a specialist. The associate specialist posts are no longer given out. There's no such contract anymore, but there are still people that are on associate specialist contracts from before.
And so what difference has it made? What's happened
To
improve
improve
the
terms and
roles?
conditions for
Yeah,
SAS
for
doctors.
SAS doctors, yeah.
Yeah, there's many things really. I think initially, as I said, the SAS contracts were renegotiated. Sorry, I think before I said 2016, it was 2008 previously, the SAS contracts. And they were renegotiated in 2021. There was some work put in to promote the specialist role as a progression in SAS careers to recognise SAS doctors who were more experienced clinically, and those who wanted to take on a role with more autonomy and less supervision. So there was that negotiation in 2021. There's been a lot of work done by locally, regionally, nationally recognised SAS doctors, of which 6 have formed something called the SAS Collective, which is a great organisation or collection of individuals who support SAS doctors with their career development and making the SAS career an enjoyable, sustainable and equitable career for doctors.
So it's the combination of the contractual changes and then the pressure group, if I could call your collective that, has made it better. I remember when I led the gender pay gap review that there was quite a significant pay gap in SAS doctors, and I can remember the Department of Health being very clear about making sure that part of their new contract for SAS doctors would reduce the gender pay gap. So I suppose forces pushing in the right direction.
Definitely. And I think if we're talking about things like pay, this one of these kind of important things to consider about SAS doctors and having a SAS contract is that they're permanent contracts, and as you progress through more experience, you actually progress through the salary scale, and so you are kind of progressing in terms of pay.
So did they used to not be permanent contracts?
Yeah, there would be permanent contracts, but they were different types of permanent contracts that didn't have the same terms and conditions. So we've got better terms and conditions now that allow for things like better rest periods after on calls, and yeah, the progression in salary is improved.
And simplification of the terminology must have made a difference, because I can remember when I was trying to work out in the gender pay gap work who was in which salary band, and the number of different titles there were for SAS doctors and associate specialists and all sorts of different kinds of specialists was labyrinthine, actually. And it looked to me as if trusts were just making up a title because they had a bit of money that they wanted to employ people on. It was really complicated. So any simplification has got to be good, I suppose.
Definitely. And I think this is the thing. I think a lot of so now really you really only deal with SAS doctors if we're going on to a new contract, SAS doctors and then LED doctors, so locally employed doctors. And the difference would be if you've got the experience to push for a SAS contract, so you've got those 2 years in that specialty, then you'll usually have better terms and conditions because it's a nationally agreed contract. But if you're on an LED contract, it will be agreed at a local level, and so you're not quite as protected in terms of leave and career development and the things you're entitled to. And it's one of the things that the SAS 6 covers.
Yeah, so that was one of the causes of the pay gaps. Actually, is locally negotiated contracts where maybe ambitious HR departments get away with what they can rather than what they actually should.
Yeah.
So can I just quickly, before moving on to the SAS 6, is the SAS contract more family friendly than other contracts? I mean, does it? Because a lot of women go into SAS roles, don't they?
They do. And I think the thing about the SAS contract and the changes that have come in have made it more sustainable. So it's I think SAS doctors are less likely to be exploited for service provision. I think it's recognised that a lot of people are choosing SAS as a career and that they want the time and the recognition for external roles, leadership roles, career development, professional development, education, research. So in terms of supporting professional activity, it's much better. Support for rest after on calls is much better. So recognizing that we're people too, we don't just do fill the rota gaps. Yeah, so definitely.
So that's good. So now tell me about the SAS 6.
The SAS 6. So the SAS 6, as I mentioned, was started by the SAS Collective, who are 6 SAS doctors who are influential on I'd say, a national level. And they've all held roles within leadership, and they're influential in SAS advocacy. And these 6 SAS doctors noticed that there was a difference between the sort of the aims of NHS England in terms of trying to support SAS doctors with career development, the difference between what was said and what was actually being done by trusts on a local level. So they came up with 6 aims that would help to support SAS doctors, and were very active in trying to get first organisations, but then also trusts to sign up to these 6 aims. And the really good thing is that they are holding trusts to account with regards to these 6 things, and touching base with them and making sure they're making progress with these things.
So what do they do? How do they do that?
So they have regular meetings, and they have a point of contact within the trust who is responsible for updating them. Yeah.
Wow, that's real systems leadership, isn't it? It's fantastic.
It is.
So what are the 6 things? Just briefly.
The 6 things. So apologies, I'm going to be reading from my from my notes, just that I don't
want to forget one of them.
No, I don't want to forget one of them, and I'll try and have a bit of a brief kind of interpretation of what each one means for me. So the first one is about when you first come into a SAS career. So it's every early career SAS doctor should have access to an educational supervisor. So this one would have been really helpful for me when I was starting my SAS career, because I think I would have then realised that I could have had access to a lot more educational opportunities if I had kind of pushed a bit more for them. And I think, yeah, those first couple of years as a SAS doctor, you can kind of be a little bit fooled into thinking, well, actually, my educational development doesn't mean too much, but it really does. The second one, all SAS doctors should have equity of access to professional development opportunities relevant to their stage of career. So again, this is talking about professional development, but any type of professional development you might choose. So you might find that you want to go into leadership and management type roles. You might want to go into representative roles. You might want to go into education, those types of things. But it's about getting SAS-shaped seats at all tables where there's opportunities for professional development. And that's something that I'm a big advocate for within the roles that I carry out locally and nationally. The third one, all specialty doctors who meet the required capability should have the opportunity to become specialists. So we touched on this a little bit earlier about that career progression clinically, and what qualifies you to be a specialist will differ according to your specialty and the trust that you're applying to be a specialist with, but usually there's more autonomy with that role, which recognises your level of experience. So moving on, number 4, senior SAS doctors should be offered the opportunity to be educators at every level on a par with consultants, for example, educational supervisors, clinical supervisors, directors of medical education. So again, this is recognising that experience that SAS doctors bring, and that you can actually have a situation where SAS doctors are as experienced, if not sometimes more experienced than consultant colleagues. And it's good to be able to share that with trainees, medical students of all levels, dependent on your experience. Number 5, all extended roles in leadership and management should be open to all substantive medical staff, that is, consultants and appropriately experienced SAS doctors. This is something that personally I've found quite a difficult thing to roll out at a local level. It's things like people presuming that because you're not a consultant, your influence doesn't hold as much weight, those things. So I think a lot of my journey over the past 4 years or so has been about proving that wrong.
That's
And
it's a really interesting problem for the medical profession, particularly given that the SAS doctor group probably, to correct me if I'm wrong, is made up of women and people from minority ethnic groups. Is that right? That's
definitely,
tricky
yeah.
then, isn't it? That's a tricky one to square. Okay, so that's number 5.
Yeah.
Last, number 6.
The last one, so this is the one that we mentioned before about locally employed doctors. All locally employed doctors employed for more than 2 years within one NHS employer should be offered the opportunity to transfer to the appropriate SAS contract. So this is offering people the opportunity to have better terms and conditions and more protection by their contract, and also a bit more longevity. Hopefully, there
Gives
will
a
be
pipeline.
substantive.
Does it give a pipeline to the SAS? Because it's interesting, isn't it, that the perception is that it's for people who've fallen off or not got onto the ladder, but actually what you're doing, what the SAS 6 is doing, is creating a pipeline for a proper level of career progression.
Yeah, I think it's tricky to kind of think of it as a pipeline. I kind of like to more think of it as they're giving multiple ladders
Yeah.
for climbing up, and whatever ladder you choose.
Okay. So why did they choose just those 6? Those were the most important.
I think these are the things that really apply to that limit SAS career development, and every SAS doctor will have had frustrations about at least 2 of those things. I know personally 3 or 4 for me, and I think it's just that it's a subtle challenge. Well, I'd call it subtle because I think my arguments have been certainly less subtle in the past. To I think what I call what is the medical structure of how doctors progress. So it's a challenge for that, and it's just to open up people's minds that doctors are human beings, not human doings. We should be and not do.
Yeah, I've always felt that a lot of the culture and the structure, indeed, of the NHS medical professional career progression it hasn't really evolved. It started in the 1950s, and we're now in the 2020s, and the career development structures are stuck in the 1950s, but we're all now different. The demographics are different. Who we are is different. What we want is different. Needs to update itself. So this is a really fantastic way of doing that, isn't it?
It is,
So
and sorry,
yeah,
the frustrations for women that think that they have to, like you say, kind of stay within the pipeline and get these things done and then plan a family after or during that and around that. That's really frustrating, I think, and limiting personally. So
it's really
yeah,
difficult. I can tell you, it's really difficult for those that I've seen, and also for myself. You're sort of constantly like a juggler on a motorcycle, and you're just worrying all the time that you're going to be dropping balls. So can we I just want to recap on what those 6 are. So number 1, educational supervision.
yeah. So being
2,
entitled to educational supervision when you first start within your SAS career.
okay. 2 is professional development.
Yeah, so equity of access to professional development opportunities.
Then access to become a specialist, number 3.
Yeah,
Being able to be an educator, number 4.
yeah,
Um, Number 5 is that all roles can be open to SAS doctors.
yeah. Roles in leadership and
And
management. I think the important one about this one, Jane, is that,
yeah,
and this is something that I've found through advocating for this point quite a lot, is that some colleagues will think that it means that, well, what's the point in becoming a consultant if SAS doctors can do it? And it's not that all SAS doctors should be able to do it. It's SAS doctors with the appropriate experience.
yeah.
So if you, yeah.
So you don't want to tick those or scratch those wounds about people getting into the elite through the back door. Is that right?
That's right.
What
Yeah.
about number 6? I can't remember number 6. That's
Yeah. So this is the LEDs. So giving them the opportunity after 2
okay.
years.
So the locally employed doctors, of whom there's a huge number, isn't there? People who come out at F3 or what have you, should have the opportunity to go in to SAS or indeed the pipeline.
Yeah, that's it. And also recognising those international medical graduates that might have come with no specific experience in a specialty, that they've been in those roles and that they can now go into the SAS roles.
So it sounds as if it's all about flexibility, which is absolutely what we need, isn't it, to open out the profession, the structures for all of the people that want to join in. Because for goodness sake, we need our doctors, we need more of them, and we need to give them flexibility to be able to make it fit in with their lives.
Definitely. I think it's a case of personal well-being as well, and not feeling as if you have to constantly tick boxes and fit molds, because people don't do that. People are people. We're not robots. So feeling as if you can have some level of choice and control over your career. Control is the thing that really gets people excited, I think.
So you're a fantastic advocate for SAS doctors. So there is an event that maybe you want to tell us about.
Yeah, so SAS Week is coming up. This is an annual thing that has been coined by NHS employers and the BMA together. And this is the 4th year that we're celebrating SAS Week. SAS Week this year is the 6th to the 10th of October, and it's an opportunity to showcase and highlight the achievements of SAS doctors within different trusts, and also on a national basis, and to share information and offer support to people that want to develop their SAS careers. So yeah.
And what sort of things are going to be happening?
So we've got national level webinars by the BMA and the NHS employers that are happening. There'll be a lot happening on social media, people like myself and the SAS 6 sharing opportunities and examples of SAS journeys. And also locally at a trust level, there should be things going on organised by, I like to call it the Holy Trinity, which is the SAS tutor, the SAS advocate, and your SAS LNC rep. So those 3 individuals should be coming together and organising things on a local level.
Fantastic. And you've been developing your own advocacy. Tell me about that.
Yeah, so I have been really fortunate to have a role within the MWF as a SAS rep with another psychiatry colleague, Kate Aldersey. And also I sit within the SAS committee in the Royal College of Psychiatrists as the forensic rep. And I'm also an LNC rep for my trust for SAS doctors. So all of this has kind of led to me having experience advocating for SAS doctors in terms of their contracts and job plans, terms and conditions, but then also looking at things like career development and equity of access to opportunities. And one of the things that I've found really useful for me, and then also on reflection useful for others, is that peer support element. So there's, for example, social media is a really good way to do that. So there's, we've actually managed to create a SAS women private group on Facebook, which is really active and supportive, and a nice environment for people to share their stories, but also to ask questions and get an idea of what's going on in other trusts.
Wow, so somebody was very misguided if they thought that SAS doctors couldn't be leaders, Victoria. Thank you very much for talking to me, and remember, anybody that's listening, that SAS Week is coming up, and if you're interested, do dip into the things that are happening, sounds like locally and nationally. So thank you very much for your time, and I hope people enjoy listening to